Hello and welcome to another Facebook Live broadcast with MedStar Health. My name is Sarah Ridenauer, and today I'm joined by vascular neurologist Dr. Amie Hsia and neuroendovascular surgeon Dr. Paul Singh discussing strokes. Strokes can be scary, so if you've ever wondered if you would recognize their symptoms, stay tuned to learn about the different types of strokes, how they are managed and treated, and what you can do to reduce your risk. Give us a like to let us know you're watching. Share this broadcast with your friends, and if you have any questions for our experts, please ask them in the comments below. Thank you both for joining us today. Before we get started, could you each tell us a little bit about yourselves and the work you do at MedStar Health? I'll start with you, Dr. Hsia.
Thanks so much, Sarah. Really happy to be here, especially during Stroke Awareness Month, the month of May, to be able to talk to everybody about stroke. So I'm Dr. Amie Hsia. I'm the medical director of the Comprehensive Stroke Center at MedStar Washington Hospital Center. I am a neurologist who is specialty trained in vascular neurology. So really all of the things that affect the blood vessels, the blood supply to the brain and the nervous system. I oversee the stroke team and stroke program at our hospital, which includes responding to acute stroke emergencies from the emergency department or anywhere in the hospital. And then determining what treatments patients are potentially eligible for, trying to change the course of their stroke, and hopefully minimize any disability that they may have due to the stroke. And then we also work hard to see if we can identify what the cause of the stroke is, to determine what's the best treatment regimen to prevent another stroke from happening again, while also starting their recovery phase for recovering from the stroke that they're having and making sure that they get to the right place after they do not need to be in the hospital anymore.
Great, thank you. And Dr. Singh?
Thank you for inviting me as well to be part of this Facebook Live. Such an appropriate time to do it with this being Stroke Awareness Month. And it's an honor to be here with Dr. Hsia as well. Just before the broadcast started, we were chatting and I just reminded myself about this. I met Dr. Hsia nearly 20 years ago, and she was one of my first mentors when I got involved in stroke research and stroke clinical care down at the NIH and Hospital Center. So it's a pleasure to be here as well and come back full circle over here. My background is also stroke neurology, and after stroke neurology, I followed that with neurointerventional or neuroendovascular surgery. It comes by many nomers. And what that means is that after the medical management of the stroke that's finished urgently, we can potentially take our patients for something called a thrombectomy, or removal of a blood clot from the brain that's leading to stroke symptoms. We can also treat hemorrhagic stroke by treating aneurysms or treat other vascular abnormalities either in the neck or the spine as well. I am currently the medical director of the thrombectomy capable stroke center up in Baltimore at Franklin Square Medical Center. And I'm also director of neuroendovascular surgery, and I'm vice chair of the Maryland Institute of EMS Quick for the state of Maryland as well. So thank you again for inviting me.
Yeah, thank you for joining. And like you said, a full circle moment. This is awesome. So let's get into our questions. First of all, Dr. Hsia, what does it mean to be a comprehensive stroke center?
So a comprehensive stroke center, and this is certified by a national accrediting organization, means that we can take care of the most complex strokes and provide every level of care that is needed. Up until through the neuro ICU with neurosurgical interventions when necessary, and be able to take care of the entire patient and anything that may be going on with that patient at the time, and offer the highest levels of intervention and treatment, as well as supportive management for those patients, including those who are critically ill.
Okay, and then Dr. Singh, what does it mean to be a thrombectomy capable stroke center?
Sure. Franklin Square Medical Center is a thrombectomy capable stroke center. And as Dr. Hsia said, this is a nationally recognized accreditation or certification that has several tiers. Comprehensive stroke is the top, which means you can comprehensively care of any neurovascular patient of any complexity, any difficulty. The next tier is called thrombectomy capable. That means you can take care of ischemic stroke patients with that same level of complexity, but you're not certified to take care of hemorrhagic stroke specifically when it comes to aneurysm treatments or other vascular anomaly treatments. That being said, Franklin Square is on the verge of applying for comprehensive stroke certification because we have many of the same resources and capabilities of our sister hospitals down in DC at Hospital Center in Georgetown. It's worth noting there are two other certifications called primary stroke certification and acute stroke ready certification, which are below those tiers, but just as important. They just can't do the acute cutting edge treatments that the TSCs and CSCs can do.
Okay, thank you both for explaining that. So what makes stroke so scary? And Dr. Shah, what exactly happens during a stroke?
Yeah, I mean, I think one thing that makes it so scary is that it's typically completely unexpected and happens all of a sudden. And so that's really the consistent symptom and recognition, is that something has changed all of a sudden for the patient. And so whether, that person was normal when they went to bed the night before, and woke up with new symptoms, or they're doing their regular activities during the day and all of a sudden they have the onset of symptoms. It can be challenging for people to recognize because it doesn't present the same way every time, and nor for every individual. And it all just depends on what part of the brain is being affected. So it's not a classic single presentation for every patient. And so we use an acronym to try to help patients or people in the community remember how to recognize stroke. We use BFAST. And so the B for balance, E for eyes, having some problem moving your eyes, F for face, and a drooping of one side of the face, A for arms with drift of one of the arms, S for speech. So some type of speech abnormality, trouble getting your words out, coming up with the right words, understanding what people are saying to you, and T for time, meaning if you have any one of these symptoms or some combination, then we want you to call 911, and because this is a medical emergency, because of these acute treatments that we can talk more about that are available, again, to try to change the course of events and minimize any disability.
Great, thank you. That you got to one of my questions ahead. I was gonna ask about BFAST. But before we get into more about symptoms, can you talk about how MedStar physicians work together if you have a patient that's showing stroke symptoms? For example, if someone goes into like a primary care physician's office with those symptoms, how do you all work together for their care?
Yeah, so I'll start and then we'll hand it over to Dr. Singh, because that's really how we work together when we're triaging and coordinating our care. So if a patient were to show up at a primary care physician's office and the staff at that office are concerned someone's having a stroke, they will call 911 and the ambulance will bring you to one of the area hospitals, and typically the closest hospital, depending on how you're presenting. And I think we can talk more about that as well. But also importantly, when a patient shows up at an area hospital, then we also have our already established patterns and practices of being able to coordinate that care. So if a patient shows up at one MedStar hospital, and we talked about these different tiers of capability, and so we have primary stroke centers that are distributed across the region, and they can evaluate the patient, do emergency brain imaging, give a clot busting medication if that's warranted. And then, so when the patient shows up, they will also activate either an in-house neurologist who is there on site and able to evaluate the patient immediately, or they will call our MedStar telestroke program. And that the person who responds to that is one of us, the stroke neurologist, who will talk to the emergency department physician. We will directly review the brain imaging that's obtained, and if necessary, we can see the patient over video and just beam in directly to that emergency department to evaluate the patient directly, and then make a treatment decision about whether or not this patient is eligible for clot busting medicine or needs to be transferred to either one of our comprehensive stroke centers or thrombectomy capable stroke centers for consideration for further treatment. And so when we're triaging that patient, then, in that case, if I were to be the one seeing that patient remotely at another emergency department and have assessed that this patient, I think, needs to be transferred over for further advanced treatment, then I would call, say if Dr. Singh was on call for MedStar Franklin Square for considering this patient and to receive this patient for treatment.
Okay, thank you. And so my next question, we talked about BFAST and the symptoms for that. Why is it important to get to the hospital as soon as possible if you're experiencing those symptoms, Dr. Singh?
So it's a great question. And just before that, if you don't mind, Dr.
Yeah,
Shaw was
sure.
talking about the MedStar network, and it's very true. And just to echo her sentiment on that, the MedStar network is a large network, and sometimes we're worried about large networks in delivery of care, but it's actually such a strength of our network. Our network has so much redundancy built in, so much experience built in, that when anybody has stroke symptoms across the network, first and foremost, all our primary stroke centers, all our primary physicians have to undergo education and training annually to recognize those signs and symptoms of stroke. So if it happens in a primary care office, they know what to do. They know who to call. They know to call that MedStar telestroke network. They know who to specifically request for help.
Mhm.
The MedStar telestroke network that Dr. Shaw mentioned is also fairly expansive, and it includes physicians across the entire network from DC to Maryland who are evaluating these patients over televideo and health. And then they will decide where the best location is for this patient to go if they need more intense care, such as a CSC or a TSC that we mentioned before. And that network is also just as broad. What you'll see is that sometimes patients come in bundles, and sometimes lots of patients will have a stroke, unfortunately, at the same time. And that telestroke service will be able to figure out where and when those patients should go to get these life-saving therapies. Now, that ties exactly into your question where you said, why is this so important? Why is it so urgent for these patients to get to these sites? Well, we live by the dogma as stroke neurologists that time is brain.
Mhm.
And for the last 20 years, we've had this number that's thrown around. It's just fairly accurate from one of our studies back in the mid-2000s that says for every minute that goes by, we lose about 2 million brain cells. And it's very true. Every minute that goes by that there's a blood clot in the brain that's stopping blood flow, that's not allowing a certain area of the brain to receive normal blood and oxygen and sugar, that area is dying. So the faster these patients can get to the right center to get either clot busting medications or a procedure to remove clots, the better the odds that they walk out of the hospital or that they have less disability. And that's why it's so important to recognize these symptoms. One thing that's hard with the symptoms is the neurological symptoms, over 90% of the time, don't have any pain associated. When
Mhm.
somebody has a heart attack, you have chest pain.
Yeah.
That's scary. You get pain, pain means see the doctor.
Mhm.
When you have a stroke, many times you don't have pain. And so people wait it out. They're like, let me rest it off. Let me see if it gets better. And that's not what we want. We want to educate everybody to know just because you don't have pain doesn't mean it's not serious. It's a heart attack of the brain. That's what's happening. You need to get seen quickly, use fast, and get seen and evaluated so you can get those life-saving therapies.
Great, thank you. Um, and then, so different types of strokes. Can you go over those and if there's different symptoms associated with each one, or maybe some symptoms that show up more commonly in one type of stroke versus the other? Can you talk about that a little bit, Dr. Shaw?
Yeah, so the two types of strokes that we have are a blockage type of a stroke, where a blood vessel gets blocked by a clot. And then the other type is a bleeding type of stroke, hemorrhagic. So there's a rupture of the blood vessel and bleeding into the brain where blood shouldn't be. It's not reliable to be able to sort out just by this patient's symptoms, both for people in the community that are non-medically trained, but even for those of us who are medically trained, it's not reliable for us to be able to look at a person based on their exam and determine if this is a blockage type or a bleeding type of stroke. Instead, we need to do brain imaging in an emergency basis in order to see and visualize what is going on. And the importance of doing this is because the treatments are different. And so we have clot busting medication that we could give, or trying to remove the clot from within the blood vessel itself for the blockage or ischemic type of stroke. With the bleeding type of stroke, the treatments can be more limited, but there is surgery that could be done depending on the situation to actually evacuate and remove the bleeding that's happened into the brain in some situations. And also depending on the underlying cause of the bleeding, of treating and preventing further bleeding from happening through surgical interventions. And so the important thing for either of these stroke types is, again, the consistent presentation is that symptoms happen all of a sudden. We're not looking for anybody to sort out on their own which type of stroke they're having. We just want you to call 911 because these treatments are time sensitive. The sooner you come to the emergency department, the more time you give us to do the tests that we need to do, and the more potential opportunities there are for treating and again, changing the course of the disease.
That's great. Yeah, and you answered my next question too, which was the differences in types of treatment. Dr. Singh, did you have anything to add to that?
No, Dr. Shaw did a pretty comprehensive answer on that.
Perfect.
It all comes back to what she closed her statement with, is that it's hard to know whether when you're at home or even in an ambulance, what type of stroke it is. But time is of the essence. And that's not your job at home to figure out what's going on. That's our job. So get to the hospital, let us figure it out, and let's prevent disability as much as we can.
Yep, exactly. Thank you both. I'm gonna pause for a second and say thank you to our viewers for tuning in. I'm joined by vascular neurologist, Dr. Amie Hsia, and neuroendovascular surgeon, Dr. Paul Singh, and we're discussing strokes. Strokes can be scary, so if you've ever wondered if you would recognize their symptoms, stay tuned to learn more about the different types of strokes, how they're managed and treated, and what you can do to reduce your risk. Give us a like to let us know you're watching, share this broadcast with your friends, and if you have any questions for our experts, please leave them in the comments below. And speaking of that, we do have a few questions from our viewers. First one is from Brittany, and she asked, what causes strokes? Which is actually a question I had coming up too, so that's perfect.
You want to take it, Dr. Singh? Or
Sure. So, when we talk about what causes strokes, there's two different areas for sure. We're talking about hemorrhagic or bleeding strokes and non-bleeding strokes. Well, the risk factors for these strokes are very similar. And you have modifiable risk factors and you have non-modifiable risk factors. I think the ones that are really important to focus in on are the modifiable ones. So what can you do to decrease your risk of stroke? Common risk factors are high blood pressure, smoking, high cholesterol, diabetes, heart disease, kidney disease. These are all things that we can consciously make an effort to improve, either by taking medications or living a heart-healthy diet and doing moderate physical activity as tolerated. I think all those things are very important as risk factor modifications to prevent both types of strokes. Now, there's other causes of strokes that are not within that modifiable risk, and it's important to realize that even though we're talking about these specific risk factors, stroke can happen to anyone. We treat strokes in the young that are very unfortunate. We treat strokes in patients that have no foreseeable risk factors. They're very healthy, they've always been healthy, and they just happen to have a stroke. So, it's hard to focus our attention on some of those other areas that we can't control, but the risk factors are the area that I like to focus on when we're talking about prevention.
Great, thank you. Thank you for your question, Brittany. We also have a question from Lillian. She says that her husband had a stroke and has recovered well, but seems to have some memory problems now. And she's asking about, she read something about vascular dementia. Can one of you speak to that and give a little detail as to what that is and if that is a common thing with stroke patients?
Yeah, I mean, vascular dementia and just under the category of dementia overall. I mean, so people who have cognitive problems, when they have vascular disease and basically disease of the blood vessels in the brain, and when they've had either a stroke or they can have also just small areas of injury to the brain due to the tiny blood vessels in the brain that may not cause symptoms at the time when it's causing a little bit of damage, but the accumulation of these effects can affect and impair your overall cognition. And so it is common and more common the more we learn about it, the more we look for it, that we're increasingly identifying and diagnosing people as having dementia that's being caused by underlying disease of the blood vessels of the brain. And so, I mean, in terms of trying to treat, prevent, reduce the effects of vascular dementia, it really is going back to controlling these risk factors that Dr. Singh talked about. So these common risk factors for heart disease and brain disease or stroke, by treating your high blood pressure, controlling it aggressively, keeping your blood pressure normal, treating your diabetes, if you have it, or even just being screened and making sure that you're identifying if there is underlying diabetes, treating the high cholesterol, quitting smoking, doing physical activity. physical activity also helps your cognition as well, and cognitive health. So all of these things are things that people can do to positively impact their cognitive abilities.
Great, thank you. And thank you for your question. We're going to talk a little bit more about what happens in a stroke's aftermath in a few questions. I don't want to skip to it just yet. But so getting back to my questions, I've heard the term mini stroke before, but I'm being told that that is a misleading term. So can you talk about why that is an inaccurate term?
You want to handle that?
Sure, I'll go for that.
I'm happy to, but
Both Dr. Shaw and I take stroke very seriously. It's what we do. It's what we treat. And so anytime we're minimizing a very debilitating disease, and one of the most debilitating diseases there is out there, we don't think that's the best way to handle it. We want to make sure that, just like if you were to have a heart attack and you were to have a mini heart attack, you still have to take that seriously so you don't have that bigger heart attack on that. You don't want to have a big stroke. And we know that mini strokes, or even a small stroke that you might have, is a bad harbinger that you might have a future stroke within the next month, even the next 48 hours. Your risk goes up once you have one. And so mini stroke comes by many names. Sometimes you just have a small stroke with minimal symptoms, but it's still a stroke. The other mini stroke word that I've heard about from patients before is something called a TIA, or a transient ischemic attack, which is when you have stroke symptoms that then go away on their own. We take that just as seriously, because once you have one of these mini strokes or TIAs, again, you're at higher risk for having a big life-changing stroke within that next month. So you have to address those risk factors, and you have to get fully evaluated to make sure that there's not something urgent that needs to be treated or fixed to prevent you from having that other stroke. You need to have a full heart workup, make sure there's no abnormalities there. We need to check the blood vessels in the neck, make sure that you have no narrowings. You have to make sure that the blood is not too sticky, and you have to make sure that you're on the right medications so that you don't have that increased risk of stroke. All important reasons.
So speaking of that, my next question, we already talked about things that you can do to minimize risk of stroke. First part of this question, are there things that you can do maybe more at home on your own to minimize stroke risk? And can they be prevented at all, or is it just about minimizing risk? Dr. Shah?
yeah, I think if you are concerned, and everybody really should, meet with their primary care physician, have their standard physical examination, routine lab tests, have their blood pressure measured, and just go over risk factors, including, risk factors from your family history. Did your parents or siblings have heart disease or stroke, or other contributing risk factors that we've talked about, to really just do a once over and see what are the areas where you could focus on. And because prevention, yes, we can all do things ourselves. We have agency, we can reduce our risk of having stroke or a heart attack by being aware of our risk factors, and then making sure that we are managing these risk factors, taking our medications as prescribed, eating a healthy diet, and we advocate for a Mediterranean diet, doing physical activity, and making sure that, even over the course of a day, that you are just remaining physically active as you're living your life. So, some people will say, well, I don't have time to go to an exercise class, or it costs too much to go to a gym. Well, make sure you're walking the stairs, and you're constantly moving, and that you're doing things that are keeping you physically active throughout the day. These things are proven to keep you to keep your heart and your blood vessels healthy. And so I think, and then all these lifestyle management, lifestyle risk factors are incredibly important. And so other things besides diet and exercise include making sure that you're getting good sleep. Each of these things all add up to affect each other. And by optimizing all of these aspects of your life and your health, then you can reduce your risk of stroke and heart disease.
And so then, Dr. Shaw, when should patients start doing these things, or start talking to their doctor, monitoring their risk, or seeking treatment? Is there a certain age, or does it, I know you mentioned family history, does it maybe differ depending on that?
Right. And, I think checking in with a primary care physician, and certainly if you have family history, particularly family history where someone in the family has had stroke or heart attack at a young age, then that would prompt you to make sure that you are being evaluated and having this comprehensive assessment at a younger age compared to somebody who has, no known risk factors and no family history.
Okay, thank you. So Dr. Singh, if a stroke does occur, can you or a loved one choose where you receive care?
It all comes back to what we were saying earlier at the beginning of this, and that time is brain. You need to if you're having stroke symptoms, you need to get to a center that can evaluate you and potentially treat you as fast as possible. Our EMS network, whether it's in DC or Maryland, knows where to take you based on your symptoms. If you have stroke-like symptoms and they're very severe, they're going to take you to a center that not only is able to give you clot-busting medications, but can also do those procedures to remove clots. If your stroke symptoms are not as severe, you may not need to go to that center that has the ability to remove clots, but to a center where you can get the clot-busting medications. Once again, when you're having these symptoms, your job is to just recognize them, and then do the T and be fast. Call 911 or have a family call 911. So that ambulance crew, that EMS provider that has that experience in recognizing the signs and symptoms of stroke can figure out where to take you.
Perfect. Thank you. And so I'm going to merge these next two questions together and I'll ask them to both of you. What happens in a stroke's aftermath and what should people expect in terms of recovery?
Yeah, so even while you're in the hospital and while we're doing diagnostic tests, sorting out what medications you should be on, any other treatments that are needed, in parallel, you'll also be evaluated by the physical therapist, the occupational therapist, the speech therapist, and the rehab medicine physician in order to come up with and assess what are the ongoing disabilities that you're having, what are the adaptations and exercises and therapies that may be necessary to help you, again, to optimize your outcome and your function, and what is the best place for you to go after you are ready to be discharged from the hospital. And so, once you're ready to leave the acute care hospital, then you may be ready for going to an acute inpatient rehabilitation facility to get more intensive rehab therapy. You may be ready to go home with or without outpatient rehab therapy, or maybe you need further time to recover and can't yet tolerate a lot of aggressive rehab therapy and may need to go first to a skilled nursing facility. And so, in the hospital, all of these teams and they work with the primary medical teams to just coordinate that decision-making with the patient, with the family, and just identify the best next steps. And then, of course, recovery would continue from there with whatever support is needed.
Okay, thank you. Dr. Singh, did you have anything to add or
No,
just cover it all?
I think that it's great to understand the two areas of recovery as well that Dr. Shaw was talking about. You have the inpatient side. So again, when you're in the hospital, you have speech therapists, occupational therapists, physical therapists, physiatrists, all helping out to make sure that you can recover the best that you can. Stroke is scary. It's a surprise. Patients don't expect it, but families don't expect it either. And so as much support as you can get during the hospitalization is important, but also after the hospitalization. That's the part where a lot of the rehab has to happen, not only from team members from rehab services, but from family. And you really have to incorporate your family into that rehab plan. Also knowing that it's not going to happen instantly. It's going to take time. So you need to have that family network, that family support to work closely with your therapists, your physician, and to rehash your PCP. Just because your PCP is screening you for risk factors doesn't mean their job is done there. After you have a stroke, it's even more important to see that PCP to make sure those risk factors are even better optimized, that you're on the right medications moving forward as well. So that's the only thing I'd like to add is that just that downstream effect of rehab is really, really important. And it's important to educate our families that it is a process.
Yeah, and speaking of families, that goes right into my next question, which I think is a great question. What support is available for the patient's caregivers?
I'll just chime in quickly for the facilities here. We talked about certifications and we talked about tiers of certifications. And sometimes we get bogged down to the logistics of what's required. But at the end of the day, one of the requirements is to make sure that the patients that we care for in the hospital have an appropriate follow-up network for this. And so we have actual care networks set up and support groups for our patients and their families to go to afterwards to understand what the ramifications are of new disability or how to prevent new injury. Dr. Shaw I'm sure, will tell you about something similar down in DC. I'm looking forward to hear about that as well. But these things are offered from each stroke center that a patient is seen at.
Yeah, and for viewers who are watching from anywhere around the country, I mean, there are stroke support groups that are located, I think pretty much distributed in many towns, cities, and areas across the country. And so, yes, in DC, there are several stroke support groups. And so for our MedStar DC hospitals, we have a stroke comeback club that's based out of MedStar National Rehabilitation Hospital, which is on the same campus as Washington Hospital Center. But for folks in Northern Virginia, there are also stroke support groups, often titled Stroke Comeback Club or something to that effect. And so it's definitely, as you ask this very important question, the support for caregivers, that is a huge need. It is an incredibly stressful time and exhausting time, both emotionally and can be physically exhausting for caregivers who they do need support, and I think really the best support is for those who can completely empathize because they're going through the same experience. Is other caregivers also supporting their family members or friends after stroke?
Yeah, that's great to hear that there's lots of options for both the patients and the caregivers after, during the aftermath and the recovery and all that. That's great. Is there anything else that either of you would like to add about the patient's journey from beginning all the way through recovery that we might have skipped over?
I think there are also, we've certainly had patients who become incredible spokespeople for really educating the community about stroke because it is obviously incredibly personal to them. For a lot of stroke patients or patients who have had stroke, this was their first encounter of stroke, and they really had no other reason or opportunity to know about it before. And then of course they've had to have all of a sudden a huge flood of information, or they've done an incredible amount of research since having their stroke, and they really are so driven and motivated to learn, to teach others and to make others aware so that others can hopefully then know exactly what to do about what action to take, to call 911 if they are suspecting that they're having symptoms, making people aware of the treatments, and then also just sharing kind of their road to recovery. And so I think, these patients who are survivors of stroke can also be incredible resources for those who have chosen to now use their recovery time and this opportunity to be able to spread this education.
Awesome. That's great to hear. Thank you. And I love asking this next question. Are there any exciting innovations or research or technology on the horizon for stroke?
Sure.
I mean, stroke is an always evolving, very dynamic field. I think it's why Dr. Singh and I are remain completely dedicated to this area. Is because there's always active research. There's active research that we participate in. There's active research happening around the country, around the world. Some things that we've incorporated or in the process of incorporating is, for example, a newer clot busting medication, more specific for clots, as effective as the original one that we used for stroke, and as safe as, but easier to deliver. And also more effective in those larger clots, blocking larger blood vessels that can potentially cause more disabling strokes. And so our centers in our area and centers across the country and across the world are very quickly switching to this newer clot busting medication. But then other diagnostic tools, prevention devices, and a lot of active research going on into how to improve, further improve our ability to help patients rehabilitate from their stroke disability.
Technology is a wonderful area that we're all very excited, and you can see the passion when Dr. Shaw is talking about that as well, because of the moves that are being made on clot busting medications. But if you take a look back, we sometimes forget how quickly this has happened. The first clot busting medication for stroke is less than 30 years old. It was 1996 when it actually was approved for usage. It's been less than 30 years that we've had any major medication for this. The procedure that we've talked about to remove clots out of the brain was only approved for actual standard of care use for stroke patients that have clots in 2015. That's less than 10 years ago. So when we're talking about innovation in this space, it's happening very rapidly. It's happening on the early side when we talk about recognition of stroke early, the treatment of stroke early, but also we're also looking at areas for recovery and rehab. And there's a lot of research going into ways to recover, not only from a rehabilitation therapy standpoint, but even from a stem cell standpoint, to see what we can do to improve the long-term care of patients. So I'm really excited, if it's only been 30 years to where we are now, to what the next 30 years hold.
Right. Yeah, like I said, I love asking that question. It's awesome to hear all the, new technology and everything up and coming for all the different medical fields that are working to improve patients' care. I love hearing about it. So my last question for the two of you, to wrap up our broadcast, what would you like to make sure people take away after joining us and listening to this conversation about stroke? I'll start with you, Dr. Shaw.
Yeah, I mean, it's remembering to how you recognize the stroke signs and symptoms. Look up Be Fast or FAST. Stick that magnet somewhere where it will stay up, and share it with your family and friends. And then just remember that time. It's an emergency if this were to happen. There are treatments that we can offer, but we need you to call 911. Or if you're with somebody who you suspect is having a stroke, don't be afraid to call 911. You may feel afraid at the time, but that really can help to save a life, or save somebody from becoming severely disabled.
Yep, exactly. Thank you. And Dr. Singh?
Sure. It's echoing a lot of the same stuff that I'm sure you guys are getting tired of hearing throughout this, but just like Dr. Shaw said, time is brain. And so don't hesitate. If you're having the symptoms of stroke, or a family or a loved one are having signs and symptoms of stroke, call 911 and get to the closest hospital. Across MedStar, the MedStar network provides comprehensive stroke care, whether you're in DC, whether you're in Maryland. We have primary stroke centers, thrombectomy capable stroke centers, and comprehensive stroke centers that can help give you the care that you need.
Yep. Be fast and time is brain. That's what I'm going to take away from this. That's a perfect way to wrap up our broadcast. Thank you to the two of you for joining us and taking time out of your day to answer our questions. And thank you to our viewers for asking your questions and tuning in. If you would like to see a neurologist for more on stroke prevention or treatment, call 443-777-7320 for the Baltimore area. And for the DC area, you can call 202-877-5026. We'll be posting those phone numbers in the comments as well. Thank you again for joining, and we'll see you next time.
Thanks so much.
Thank you. Take care.
Bye.